My name is Dr. David Pereira. I'm an orthopedic surgeon working out of the NYU Hospital for Joint Diseases. Having the opportunity to help people improve the quality of their lives, whether it's allowing them to dance with their loved one at a wedding, or get them back on the playing field, or just be able to walk without pain and play with their grandkids. I would say the most challenging aspect of the specialty is that it's ever changing, that it continues to evolve pretty rapidly as technology advances. And so you can't just rest on your laurels. You have to keep up with things, keep up with the changes. But I would actually say that that is also an aspect that I really enjoy in the specialty, because it keeps it from getting stale. It just kind of keeps stimulating you in different ways to keep learning and to keep broadening your horizons. So it's had a pretty important impact on my life, because of the area that I'm in is a pretty elective area, which means that there aren't that many surprises, so that I can have sort of a regular schedule that I can keep with my family, whether it's being able to follow through with plans that I had with my wife, or I can coach my son's soccer team, I can coach my daughter's softball team. And that's important to me, to keep a good balance between my career and patients, which are obviously very important, and my family, which is important. And I think the better I can keep that balance, the better doctor I can be. So my typical day in the office is, I'll see a series of patients with all different types of issues. Some of them are follow-ups, and some of them are brand new patients that I'm just getting to know for the first time. And then in the OR, I'm taking care of fewer patients, obviously, and usually with maybe a handful of different problems that we're taking care of. Most frequently knee problems or shoulder problems, and that's pretty much how I get through my week. In my training, I had the opportunity to work with the Laker team doctors and the Dodgers and all the professional teams out in LA, and being in the locker room and helping examine these athletes, and even now I get to do a little bit of that on a less glamorous sort of level perhaps, but I still work with young athletes on the field, high school teams and college team that I work with their athletes. So that keeps me interested in that aspect and is a lot of fun for me. Residents who are already in orthopedics will ask me for my advice on picking different subspecialties. And they'll say things like, well, I really like this, but this other field is not as glutted, and that's okay too. I sort of enjoy it. And I always tell them not to take sort of the market, if you will, into account, because the market will change. And what's glutted now and has no opportunities will change over time. There's always room for another very good person, and the person that's interested in the field is going to do a great job no matter what they pick. When picking a field, just to really immerse yourself in it, make sure that it's something you love, that's going to interest you for your whole career. It's a long time. And if it's something surgical, I always tell my students or residents, make sure you like that field and those patients in the office as well as in the OR, because the reality is, in practice, most of your time will be spent in the office.